Mm-hmm.
and go in for everything, which drives up costs of treatments.
Yeah. So maybe a drug addict may go to the facilities for free prescriptions, combinations of different prescriptions to make drugs. Oh no. Yeah. Whenever a system is in place, not only healthcare, people are going to abuse it. We are evil by nature, I'm sorry. And let me go off a tangent. I had a student who was a teacher, a public school teacher, my student in Mississippi, my graduate student. And he said when he was a teacher, there are some parents who claim, quote unquote, that their kid has this disability, that condition, that disability, that health issue, just to get a disability check for themselves every month. So whenever there's a system, people may abuse it. So you have a point. Maybe free healthcare is not a good idea. But don't they control this country by the legal resident permits? If you are not a legal resident, you cannot get free healthcare. Isn't that a form of control already? Your legality. Isn't that a form of control? Legal statuses. Isn't that a form of control already? If healthcare is free for everyone who is legal in that country, is that okay or is that not okay? If healthcare, okay, should healthcare be made free for legal residents in a country? Should healthcare be made free for people who pay taxes in a country?
Still think it'd be abused.
Okay.
There are some countries though, and I can't, because I took like a healthcare economics class and we talked about it.
Mm-hmm.
And I want to say it was Taiwan, but I'm not sure. They have like
Mm-hmm.
checks, so like if you go into your doctor's office so many times,
Mm-hmm.
they have to like investigate it and be like, why are you going in so much, to help kind of prevent people from abusing it.
Mm-hmm.
In terms of like the limits of like cards, yeah, it's just a little bit more. They have like medical cards that you like have to scan or swipe every time.
And it has like all your medical information, all your records.
Okay. What else did you learn in your health economic class? Was healthcare always the same in your country? Or there are drastic changes? From the 1920s until now, there are changes. Can you identify some of the changes? Just talk about any changes in any form. What has changed?
Like preventative care is big now. Like
Yeah.
any sort of preventative care.
Mm-hmm.
And like vaccines and things
Mhm.
that go around back in the 1920s.
Mm-hmm. So very good. I think you read ahead of time. Turn to page 252. Go to table 15.1. So now we are in the incremental improvement stage from year 2000 until now, from what you mentioned. So now there's a greater focus on preventive care. That's a characteristics of incremental improvement phase. So can you describe a dentist's office? I'm sure you've been to a dentist before. So can you describe a dentist's office? Do you think the dentist makes all the decisions by himself or herself? Whenever we go to the dentist's office, do you think the dentist is in charge?
Of the business or the healthcare being provided?
The care, the treatment, not the business, sorry. Do you think the dentist is in charge? Or if you go to a small family practice, do you think the doctor is in charge? A small family practice, do you think the doctor calls the shots? Or he has to listen to other entities, the insurance company, the government, the Medicaid, Medicare?
He has to listen to all of them.
But can you see that? Can you sense that? Or you still feel that he or she is in charge? If you go to a dentist tends to be smaller, their offices. Or a small family practice, Do you think your physician is in charge?
Yeah, I would say so.
Okay. So maybe things may not have changed that much. There are still some overlaps in these 4 stages. 252. The table 15.1. Maybe they still have some professional domination. It's not that different from the 1940s. Yeah, sometimes we feel that our dentists, our family doctors are somehow somewhat in charge. Even though now we know, in the background somewhere, maybe they are influenced. The way they make decisions on us are different, influenced by the insurance companies. They are big players now. Or they are influenced by the government regulations, all kinds of regulations. Or Medicare, Medicaid, and all kinds of entities when they make decisions. But we somehow feel that they can still make major decisions on us. I mean, give suggestions on us without being affected by all these entities. So, according to your book, the healthcare, the medical care in your country go through 4 stages. The first era is the professional dominance era. It starts right after World War II, and it ends in the mid-60s, before Medicare comes in, Medicare and Medicaid. So during this era, doctors has a lot of autonomy, doctors, dentists, and they are less influenced by other entities, insurance, government, regulations. Non-profits, NGOs, that pressure them to do certain things. Doctors had lots of autonomy during this era. And according to your book, their clinics tends to be smaller but more generalized, less specialized during this era. Maybe you watch Little House on the Prairie maybe once in a blue moon sometimes. Or sometimes your grandparents watch that and it's just on in your TV, on your TVs. It just happens to be there. So if you watched Little House on the Prairie before, I'm sure you remember the doctor in that movie. He was everything. He was a physician. He was also the vet. People bring their animals to him. He was also the dentist. He was also the optometrist. Doctors in this era, the professional dominance era, even though they are not like the doctor portrayed in Little House on the Prairie, but they tend to be more general. And there are 2 kinds of health facilities in those eras, in the mid-40s to the mid-60s. There are those small general practices or the small independent non-community hospitals, page 251 somewhere. And those independent non-profit community hospitals, they tend to be more general too, less specialized. And doctors, other medical professionals in those entities, they were less scrutinized by insurance companies, by rules and regulations from the government during those times. So these are the main characteristics of the first era. And it seems because medical professionals had more autonomy, so medical care takes a more voluntary ethos from when you had more autonomy to suggest treatment, to do your diagnosis, to do certain prevention procedures. And it's somewhere on your textbooks. The governing entities of medical professionals in the first era, they tend to be more generalized to the American Medical Association. Maybe it covers a broad range of specialties under it. Soch 462.
Carol Lilly, it doesn't, okay. I will call Carol, thank you.
And American Dental Association. Yeah, it's more generalized too in this era, mid 40s, mid 60s. And after World War II, maybe your government, they started to notice not everybody got access to healthcare. The dirt poor people, the poor people. When things operate the way like the first era. So they start to give federal fundings to many departments in hospitals. And 2 decades later, Medicaid came about, federal insurance system. So because of that, the government, they start to intervene in the second era, the federal responsibility era. And maybe the main goals of the second era is to close health inequality gaps, to close the gaps in health access, to make equal access to all. But when they do such things, they give a lot of federal funding and they fund a lot of trained medical specialties. Wow, they fund a lot of trainings for specialists. And they set up a lot of specialty associations. It costs a lot of money. And sometimes the outcome may or may not be intended in a positive way. All these federal endeavors, they may not reach their full potential. So maybe you were right. I see your point. It may not be a good idea to give free healthcare to everybody, like what happened in the second era. It may bankrupt the hospital and the government if you go on this way. So, private companies realize that. And they start to introduce market mechanisms in healthcare facilities. They start to charge a price, to impose a pricing system in many of the procedures, diagnostics and prevention procedures. So, when that happens, we enter the managed care era in the early 80s through the early 90s. So when we talk about managed care, they provide a more streamlined services. I'm sure you learned that in your health economic class. And you can only go to certain providers. So all these things originates from the managed care eras. It continues to these days. Look at how our insurance plans goes. We are only allowed to go to in-network providers. If you go to out-networks, you may have to pay beforehand. You may get reimbursed for part of it, not all. There are certain procedures, certain rules and regulations on where you can go on reimbursement and stuff. And services are streamlined. And during the first 2 eras, maybe, professional dominance era, maybe to a lesser extent federal responsibility era, maybe quality control is in the hands of the doctors. Even so in the second era, when government came in, I think government, they have other priorities. I think they delegate quality control to physicians. So as you can see, physicians had a lot more autonomy during the first 2 eras in your medical history. And physicians also decide on the cost effectiveness of a given diagnostic, a given therapy, a given procedure, a given preventive measures. Physicians had a lot more autonomy during the first 2 eras. And when we enter the managed care eras, physicians or other medical professionals, therapists, nurses, PAs, you name it, they may lose some of their autonomy. Now, quality control, cost effectiveness are determined by companies who are in charge of managed care. And sometimes physicians, they may not like it. Maybe you are still young. You may not have realized that. But when you reach my age, when you enter the professional or the working world, when you enter your careers, after you got your degrees, you will know that sometimes when people so-called overstep your boundaries, we may not like it. So that's what happens in the managed care era. Physicians resent that when certain aspects of their autonomy being taken away, being given to insurance companies, managed care companies, they don't like it. So, is that a good idea when we charge a price for healthcare, when we make people pay for healthcare? Is that a better idea to make people pay for healthcare? So if one cannot pay, one cannot get healthcare. One will die eventually. So is that a better solution under the third era, the managed care era? Was that a better solution than the previous two? Maybe private companies, some practitioners, some policymakers, when they see what's happened during the second era, federal responsibility era, maybe they thought government was wasting too much money on developing new specialties, on maybe developing new departments in hospitals, doing research, developing new drugs. It was all under federal funding during the second era. And it seems that the outcomes are not as positive as they wanted it to be. So they try to change certain things. It gives rise to a new era. So is the managed care era better? Now, yeah, healthcare is based on market mechanism, demand and supply. The price for different procedures, different measures, different therapies, different diagnostics are based on demand and supply. Is that a better scenario? Why not? So when it's free, it's not good. When there's a price, it's not good. What is the best?
Well, I'm just saying, like, if it's based on supply and demand, the price is set. I mean, like, as you can see, like, today, it's just going to keep going higher and higher and higher. And then no one's going to be able to, like,
So is the insurance company helping us?
say no.
Yes and no. You're right, yes and no. Is Obamacare effective enough? I think it's still in place. It hasn't been abolished yet. Is Obamacare effective enough? I think I read somewhere on YouTube, Obamacare does not really focus on the elderly, the procedures the elderly needs. So because of that, elderly may not get treatment. They may delay treatment, or they may forego treatment because they cannot afford it. So Obamacare does not focus on all segments of the population. Do not give equal access to all segments of the population. Do you know that? So is healthcare in Canada more effective than healthcare in your country? Is free? Is almost free? Is that a more effective system? Besides, people may abuse it. Is that more effective in general? It makes it more affordable for most people. Is that a better system, or it depends? So you still prefer your current system, even though sometimes you have to pay.
It's hard to say because, like, right now I'm under my parents' insurance. I don't have to. But when I do go to get insurance, there's a likelihood that I'm going to be denied it.
So is the deductible good enough in this country? And do you get to see a doctor right away, or you have to wait?
Like our wait time is less than Canada's.
Less than Canada. Okay. You Google that already. You found that out already somewhere.
Yeah, like
Or
I
you
think
know
I helped-
somebody in Canada.
Well, I had a health science seminar class,
Mhm.
and we talked about it. It was like how long like their wait is because it's in like such high demand because it's free.
How long? 5-6 hours?
No, like days.
Days.
Like, if not weeks and months, like to get in just to see a doctor.
Worse with like specialty.
Yeah, worse with.
And how long is the wait in this country? An hour? An hour or two? Half an hour?
Yeah, like at the clinic.
You can just walk in.
Yeah.
Generally get it same day.
Urgent care? You heard of urgent care? You can just walk in. And they will do your paperwork later on. After they give you treatment or they diagnose you. So, yeah, your book did not talk about urgent care, but urgent care are new establishments. We all know that. So would you live in a country where you get free healthcare? When you have an issue, you can just walk in, but you may have to wait. You have a point. Or you rather live in this country, but anyhow you have to wait. You may not have access to healthcare because you may not afford it, and you may not get to see a doctor. But in many other countries, socialist countries, communist countries, China, if there's a need, they can just walk into any hospitals, government hospitals, public clinics. They may have to wait, but eventually they get care. So you prefer those system or your system? So as you can see, one last point I'm going to make. We've been through 3 eras in healthcare, and I'll talk about the 4th era on Monday. So as you can see, sorry I'm jumping around. Go to page 250 in your book. The institutional approaches in these 4 eras, they changed from one era to another. And the social structure changed from one era to another. So do you know the meaning of social structure? If you had Soc 100, you will know. You will learn that. I think none of you had Soc 101, right? Or 100. You are not Soc majors. So, social structure is repetitive relationships, interactions among different people that eventually gives rise to a pattern. So as you can see, as we progress from one era to another, the social structure changed. The way how doctors interact with patients changed because of new entities come in, new rules and regulations and laws come in. The way doctors interact with nurses have changed, I'm sure. That's another social structure. So the way doctor interacts with patients is predictable. It's always the same. It's always predictable to a sense that it forms a pattern. The same with how doctors interact with nurses, how doctors interact with other nurses. So when private entities come in, it changed how people interact with one another. All these interactions are still repetitive. It forms a pattern, but the pattern have changed from one era to another. So we are going to pick up from that table, and I'll see you on Monday. Have a good weekend.
Wednesday.
This Monday. I'll see you on Wednesday. I'm off.